our special Health and Human Services Committee meeting. Today is Tuesday, July 20th, 2021, and it is 4:30. I would like to call this meeting to order. Are there any changes to the agenda? Okay. Would you like to move to add both of the resolutions, Amanda? Is there, we're just adding one? Okay, sorry about that.
Okay, yeah, sure.
Okay.
Move to add it.
Okay. Okay, so we're moving authorization to accept funds, execute contract, creation of positions, and budget adjustment, COVID-19 school grant for the health department, ID 10275, to add that to our agenda this afternoon. All those, is there any conversation to add that? No conversation seen. All those in favor? That's unanimous. Thank you. And is there anyone here for public comment? There's no one here for public comment. Thank you. We have first off, Office for the Aging, a resolution, a budget adjustment, COVID-19 vaccine access program, aging, ID 10239. If I could have a mover. Seconded by Henry. And Lisa Monroe is with us, Director of the Office of Aging. Hi, Lisa. How are you?
Hi, good. Can you hear me okay?
Yes, we can.
You guys look so tiny from my angle. Very small. So yeah, this resolution is just to accept funds for some supplemental grants that we received to assist with expanding vaccines for the aging population, expanding access to vaccines, I should say. So unfortunately, it didn't come in January when we were in the thick of it, but it did come now, which is great. And we can actually use this to claim the time back to April 1st that my staff, who deputy director, has worked with the health department directly with the vaccine response and assisting with the pop-ups and also scheduling and things like that, and assisting with the homebound population, which directly relates to this expansion of access. So we can claim her time for that. And we can also claim the time of our aging service specialists who were at that time assisting people with scheduling their vaccinations, trying to find, help them through the online process that they had to go through. So we can go back and claim that time for that. And that's what we'll use this funding for.
Great, thank you, Lisa. Are there any questions for Lisa? Henry?
No.
Do you have any questions? Okay. Let's go ahead and vote then. All those in favor? That's unanimous. Thank you very much, Lisa.
Thank you.
Next, we have a resolution for youth services. 2021 budget adjustment for decreased Safe Harbor Grant Award, ID 10249. If I could have a mover, please. Moved by Amanda, seconded by Henry. And Kate Shanks Booth. Hi, Kate. How's it going?
Pretty good. How are you? Can you guys hear me okay?
Yes, we can.
Okay. So this 2020 budget adjustment, we had received word from the state on an approximation for our CSEC funds, which is the Sexual Exploitation of Children, which is a grant that passes through DSS to us. And we guesstimated that that was going to be about $51,000 in 2021, but we got word a while back that that was actually going to be $40,000. So this resolution is just a budget reduction to reduce that from the 51 down to the 40, so that it's accurately reflected in our budget lines for CSEC this year.
Okay, thank you. Any questions from committee members? Henry Granison?
Yes, does this money go through DSS?
Yeah, so DSS initially gets the CSEC contract that works with youth, which they contract with us. And so then Bridget Nugent, our deputy director, is the CSEC coordinator for the county. So she heads up the critical team. We also have a subcontract with the Advocacy Center. They do a series of trainings. this past year in 2020, they did a training for medical professionals to help them know what to look for to be able to determine whether or not a youth may be being sexually trafficked or not, is one example. And so they work and identify youth throughout the county that may have fallen victim to this. And so that is, and then we do distribute training materials as well with this money. So that's where it comes from.
No, I just was curious about the resolve with social services and youth services. Both have $11,000 coming out of them, but it's only one $11,000. It just goes through social services, then contracts with youth services.
Yeah,
Okay.
so it's reduced in both places to be accurate. 2021.
Okay, thank you.
Any other questions? I see none. Let's go ahead and vote. All those in favor? That's unanimous. Thank you very much, Kate.
Awesome.
And we have one last resolution that was added to the agenda. The authorization to accept funds, execute contract, creation of positions, and budget adjustment, COVID-19 school grant from the Health Department, ID 10275. If I could have a mover. Moved by Henry, seconded by Amanda. Hi, Frank.
Hi, good afternoon. This grant it's actually just under $2.6 million. It's federal funding coming through New York State, and New York State has earmarked it for testing of children from pre-K through 12. So we've been working with the school districts and intend to subcontract to BOCES for three main components. The first being symptomatic testing for children in schools. If they arrive or become symptomatic, to be able to be tested before they go home to eliminate any barriers that might be in place for families. The second component is for asymptomatic surveillance testing, if districts so choose to opt into that. And the third component is to stand up a telemedicine pilot program in order to fundamentally address whether or not testing is necessary or appropriate, but we're hoping that it's something that can be expanded and be more comprehensive telemedicine program as we go forward. We are also keeping a small bit of the money to create 2 community health worker positions at the health department to help get the word out about testing and answer questions and support the school district in any testing efforts that they have to undertake. So this resolution is to accept the funds, to put a portion of those funds in the budget for 2021. The remainder will go in 2022, and to create the 2 community health worker positions.
Sounds good, Frank. Any questions? Henry?
Yeah, I had a question yesterday in budget about why we don't have the first clause, whereas pursuant to Administrative Manual Policy 502, budget adjustments exceeding $5,000 require legislative approval, and why that was in the COFA resolution, but not in this one. Isn't this also a budget adjustment?
Yeah, I guess technically it's a budget adjustment. It's accepting new funding and putting it into the 2021 budget. So if that language needs to be added, that's not a problem for us.
You know what? Let's see what Kathy has to say, what Kathy's thoughts are here.
That language that Henry's referencing is usually in resolutions that are just budget adjustments. This resolution is accepting a grant and creating positions. So it's a different action being taken.
Okay, thanks.
Thank goodness for Kathy Covert and Katrina and Brittany. Okay, any other questions for Frank? Okay, I see none. Let's vote. All those in favor? That's unanimous. Thank you very much, Frank. And we have some minutes for this committee. If I could have someone move the minutes of June 21st, 2021. Moved by Henry, seconded by Amanda. Any questions or comments on minutes? I see none. All those in favor? That's unanimous. Thank you. Thank you everyone for joining us today, and we'll see you at 5:30. We are adjourned.